Today we are speaking about respiratory viral diseases, and in this topic we have to discuss at least three families: Orthomyxoviridae, Paramyxoviridae and Coronaviridae. On this slide you can see table with some features of two quite close accordingly to the biological properties families: Orthomyxoviridae and Paramyxoviridae. You can see the general Orthomyxovirus can cause disease influenza virus A, B, C types, and Paramyxovirus that can cause childhood diseases like mumps, measles, and respiratory syncytial infection, para-influenza infection. Genome. Both genera contain RNA, but in case with Orthomyxovirus, RNA is segmented in 8 pieces, and in case with Paramyxovirus, single-stranded RNA in single piece, and different diameter of inner ribonucleoprotein helix. Classification of influenza virus. There are 3 types: A, B, and C, but the most medically and epidemiologically important type A, because this virus, type A viruses, cause the most cases of influenza in humans and undergo mutations because of biological feature, and more frequently than other types of viruses can lead to epidemic and pandemia. Type B virus are endemic usually and associated with local epidemics only, and type C virus rarely cause disease and of course can't cause epidemics. Nomenclature of Orthomyxovirus. Usually name exactly the type of virus, influenza virus. After that, the name of geographic source, isolate number, after that year of isolation, and last piece of information, it's information about subtype, about serotype, it's about number of agglutinin and neuraminidase. Influenza virus A. It's medium-sized enveloped virus minus sense, and their genome is segmented into 8 pieces. It's the most important and bright biological feature of this virus. Influenza virus structure. Again, it's minus single-stranded RNA. This RNA contain 8 segments, 8 pieces, and each piece contain 1 gene. Nucleoprotein and matrix proteins are important antigens. This virus contain subunits of RNA polymerase and important antigens that are situated, localized on supercapsid, its gamma-glutamine and neuraminidase, its protective antigens, and like you can see, gamma-glutamine has more than 20 different subtypes, and neuraminidase contain 9 subtypes. And all these subtypes can change their own position. So we are speaking about potential, about possibility of this virus change own antigenic structure. And on the bottom of this slide you can see the most often types that lead to diseases nowadays. It's subtypes of virus, humans virus H1N1, H1N2 and H3N2 plus avian flu virus H5N1. It's viruses, serotypes of viruses that are the most medically and epidemiologically important. On this slide, short information about the most important, protective antigens of influenza virus, gamma-glutenin and neuraminidase. You can see gamma-glutenin encoded by RNA segment 4 and neuraminidase encoded by RNA segment 6. Gamma-glutenin glycoprotein is the viral attachment protein and fusion protein, and it elicit neutralizing protective antibody response. Except this information, you can see that gamma-glutenin is a protein that agglutinate red blood cells, and it means we can use for the diagnosis of this disease reaction gamma agglutination. Neuraminidase antigen or spike or protein stimulates production of protective antibodies. Influenza B virus, it's also enveloped virus. This virus type of influenza virus has about 500 spikes, nuclear capsid enclosed within lipoprotein membrane, and virions contain also 8 segments of RNA, but in fact much men and birds, but epidemiologically less important than subtype A, and medically less important because usually cause not so severe type of flu like A subtype. Influenza C virus type, its virions also enveloped many spikes, but you can see difference, and this difference is this type C contain 7 segments in minus RNA, and you can see a little bit different biochemical structure of spike, gamma-glutenin esterase fusion type of protein, and of course it's less important medically, in medical sense and epidemiological sense than subtypes. Subtype A, and even less important than subtype B. Antigens. Influenza viruses, like we discussed, are divided into 3 groups determined by the ribonucleoprotein antigen and M matrix antigen. Soluble antigens, RNA and M protein, which are much stable in antigenicity, and surface antigens. We are speaking about gamma-glutenin and neuraminidase agglutinin, which are much variable in antigenicity. And on this slide table that contain features of viral genera, and you can see that severity decrease from A to C type, animal reservoir possible only type A, and humans pandemics can be caused only by type A. And maybe one of the most important question on this slide you can see is antigenic changes. You can see that only type A has two different types for changing own antigenic structure. We are speaking about shift and drift. On this slide you can see process of reproduction of influenza virus. First stage, like usually, attachment to the host cell, and in case with this virus to epithelial cells by using spike protein gem-agglutinin HA. After that, next stage, endocytosis, uncoating, third stage, and after that the RNA enter the nucleus of the cell where fresh copies are made, and these copies return to the cytosol where some serve as matrix RNA molecules to be translated into proteins of fresh virus particles, and progeny virions are formed and released by budding from the plasma membrane of the cell, aided by neuraminidase to spread in the infection to new cells. And this process of budding while the releasing is common. It's understandable because we are speaking about complex or enveloped type of virus. And the same information may be a little bit more accurate about virus reproduction, influenza virus reproduction. And again, in case with influenza virus, we are speaking about minus negative sense RNA genome. It means that virus have to create, first of all, from minus sense genomic RNA, have to create matrix RNA, and for this process, and after that proteins, viral proteins, and for this process absolutely needed a special enzyme, RNA polymerase, and this RNA polymerase usually packaged in video. And on this slide you can see process of releasing of mature viruses by budding, and it's common type of releasing for all enveloped viruses, because the virus particular use host membrane for creation, for making own supercapsid, where encoded, of course, viruses protective antigens, in case with influenza virus, NA, neuraminidase, and HA gamma-agglutinin proteins. Antigenic change of influenza virus A. It's one of the most important biological feature of this virus. Its possibility to change on antigenic structure in two ways: antigenic drift and antigenic shift account for antigenic changes in the two surface glycoproteins, gamma-glutenin and neuraminidase of influenza virus. Antigenic drift is a gradual change in antigenicity due to point mutations that affect mere antigenic sites on the glycoprotein. Antigenic shift is an abrupt change due to genetic reassortment with an unrelated strains. Changes in gamma-glutenin and neuraminidase occur independently. Internal protein of the virus, like NP protein, do not undergo antigenic changes. Epidemiology. Source of infection, patients and carriers, and usually can be spread by large droplets while the sneezing, coughing, or in contact after contact with saliva, and sometimes can be direct contact. Period of incubation quite short, only 1872 hours. Symptoms: fever, headache, myalgia, cough, rhinitis, ocular symptoms, chills and sweats. Clinical responses: acute symptoms last 1 week, abrupt onset of fever, myalgia, headache and non-productive cough. Fatigue and weakness can last 2-3 weeks. Infected individual predisposed to bacterial infections caused by Staphylococcus, Streptococcus, Haemophilus. So we are speaking about secondary bacteriological infections, and the basis of this process it's abrupt, it's huge suppression of immune system by influenza virus. Complication, one more complication, is Reye's syndrome. Reye's syndrome is an acute encephalopathy of children and adolescents, and usually it's 2-16 years old patients. Immunity depended upon localized antiviral secretory immunoglobulin A and develop long-lasting circulating antiviral immunoglobulins G. So on this slide you can see that antibody to gamma-glutenin is protective antibody, to neuraminidase decrease severity of infectional process disease, and serum antibody can live in serum while the years, several years. And if you are speaking about type or serotype specific immunity, it can be even 10 years. And secretory antibody can live, secretory antibody to immunoglobulin A secretory can live while several months. Laboratory diagnosis, virological method, respiratory secretion like direct aspirate, nasal washings can be taken from the patient, and after infection, embryonated eggs cultivated for isolation of viruses culture. And after that must be used a reaction of gamma-glutination, and can be used a reaction gam adsorption. And as a reaction for identification, it can be reaction inhibition of gamma-glutination or inhibition of gam adsorption. One more variant for diagnosis is immunoferment analysis or ELISA, and this variant of investigation. It's in variant in serodiagnosis. So we are speaking about detecting antibodies in serum of patient by IFA or ELISA, and direct immunofluorescent when we use nasal washings. It's express method of diagnosis with high level of specificity, of course. And a little bit more about serodiagnosis. You can see on this slide a list of reactions and methods that can be used exactly for serodiagnosis, for detecting of titer or number antibodies in serum of patients. And you can see it can be gamma agglutination inhibition reaction, gamma adsorption inhibition reaction, ELISA or classic variant complement fixation test, or neutralization test. But anyway, must be detected titer or number of antibodies, and must be detected four-fold or greater increase of antibodies between acute and convalescent specimens. Prophylactic, non-specific hand washing, masks, and specific prophylactic can be provided by using killed whole virus vaccine, can be used a live vaccine, subunit vaccine, and synthetic vaccine. And prevention treatment by antivirological drugs is also possible. It's rimantadine, amantadine, zanamivir, oseltamivir. It's drugs that can be used for prevention and treatment, and as a result 70-90% effectiveness is detected. Now, second family for today, Paramyxoviridae. Paramyxoviridae contain two subfamily, Paramyxoviridae and Pneumaviridae. Paramyxoviridae contain genera morbillivirus, measles virus, respirovirus. Earlier it was paramyxovirus, contain parainfluenza virus, 3 serotypes from 1 to 3, rubella virus or parainfluenza virus, serotypes 2, 4A, 4B, and mumps virus, and Guinea virus. Subfamily Pneumaviridae contain genera pneumovirus, RS virus, and metapneumovirus. On this slide you can see the table that contains information about genus in Paramyxovirus family and protective antigens of these viruses. So, the most medically important viruses genus is Paramyxovirus, rubella virus, morbilli, and pneumovirus. Biological properties. Virion. Large virion consists of a negative RNA genome in a helical nucleocapsid that's surrounded by an envelope containing a viral attachment protein, so spikes. HN of Paramyxovirus spike and mumps virus has agglutinin and neuraminidase activity. H spike H protein of measles virus has only gamma-glutamine activity, and G spike of RS virus lacks this type of activity. And the structure of paramyxovirus you can see on this slide. It can be pleomorphic type of virion, but you can see two types of spikes. It can be HN or HG glycoproteins, and you can see F fusion glycoprotein spikes. And inside of particular helical nucleocapsid and RNA minus nucleoprotein, and this structure surrounded by lipid bilayer membrane, and we named it like a supercapsid, and inside of this supercapsid present M matrix protein. And again, don't forget, we are speaking about minus RNA virus, so present polymerase complex for making mRNA. And you can see on right part of this slide the scheme of point of cell fusion, and this schematically the process you can see in scheme. In the right part you can see real picture. It's action of this type of virus to host cell and creation of Gantt cell or syncytium with abnormal number of nucleus inside one enormous big host cell. Mumps. Mumps is an acute contagious disease characterized by a non-suppurative enlargement of one or both of the parotid glands, although other organs may also be involved in this infectional process. Properties of the virus. Mumps virus is a typical paramyxovirus, and this virus has gem agglutination activity, neuraminidase activity, and hemolytic activities. Gem agglutination can be inhibited by specific antibodies to mumps virus, and this inhibition can be used to measure antibody responses. Similarly, the nucleocapsid of the virus particle form the main component of the S-soluble complement fixing antigen. Mumps virus pathogenesis and epidemiology. Droplets spread the infection via saliva and secretion from the respiratory tract. Incubational period from 2 to 3 weeks. Malaise and fever is followed within a day by painful enlargement of one or both salivary glands. Possible complication in males after puberty is architis. Architis is painful swelling of one or both testicles. Inflammation of the ovary and pancreas can also occur. Disease is usually self-limiting within a few days, but aseptic meningitis is complication that the most serious complication in case with this infectional disease, mumps. And pathogenesis in periods and timing of these periods. Virus enters respiratory tract. After that, virus grows in salivary glands and local lymphoid tissue, and after that, virus spreads to spleen and distant lymphoid tissue, and after 17 days can get to blood, and we are speaking about period of viremia. And period of viremia, well, 15 days usually, and after period viremia, virus spreads throughout body to different glands like testes, ovary, pancreas, and salivary glands again. And we are speaking about real infectional disease period, and this period usually held 18 days. And symptoms, pictures, clinical pictures of this disease. You can see swelling of salivary glands, you can see architis, and you can see action of this virus on culture tissue. Right part, pathological picture with creation this abnormal huge cells with big number of nucleus and destroying of host tissue. Prevention and treatment. Specific treatment usually don't use. Prevention can be by mono vaccine, can be used inactivated or alive attenuated vaccine, or complex vaccine, mumps, measles, rubella vaccine. Parainfluenza virus infection. The parainfluenza virus are paramyxoviridae with morphologic and biological properties typical of all genus. They grow well in primary monkey or human epithelial cell culture, but poorly or not at all in embryonated egg. They produce a minimal cytopathogenic effect in cell culture, but can be recognized by gen adsorption reaction method, and laboratory diagnosis may be made by the gem agglutination, adsorption inhibition test, by complement fixation test, and by neutralization tests. Important characteristic. Typically, usually is 4 types, distinguished antigenically by cytopathic effect and pathogenically. Gamma-glutamine and fusion F protein is found in the envelope. And if we are speaking about pathogenesis and immunity, we understand that we are speaking about acute respiratory infection, and it can be mild influenza-like illness, can be sometimes bronchitis, croup, and as a result respiratory distress and pneumonia. But this more severe type of disease usually have children, transmitted by aerosol. Lab diagnosis. Virological method. If we are speaking about virological method, we are speaking about taking material from nasopharynx of patients, and we infect cell culture and detecting of virus by gem adsorption or direct immunofluorescent test. Direct immunofluorescent test, direct immunofluorescent agglutination also can be used for rapid identification of cause of disease, so direct spacement identification, and identification by antigenic properties. Accordingly, antigenic properties, I mean detection of serotypes from 1 to 3 can be provided, can be confirmed by using gem agglutination inhibition test, and for this test have to be used standardized anti-serum accordingly to serotypes from 1 to 3 serotypes. Measles or rubella. Measles is an acute, highly infectious disease characterized by a maculopapular rash, fever, and respiratory symptoms. Properties of virus. Measles virus is typical paramyxovirius. This virus agglutinates monkey erythrocytes. Measles virus also causes hemolysis, and this activity can be separated from that of the hemagglutinin. In culture, produces characteristic intracellular inclusion bodies and syncytial gland cell. Pathogenesis and immunity. A childhood disease with long life immunity, transmission and initial stage of disease similar to mumps, but this virus can also infect via the eye and multiply in the conjunctiva. Viremia period following primary local multiplication results in widespread disruption to many organs. After incubation period, 10-12 days, disease and symptoms is fever, respiratory tract syndrome like a dry cough, rhinorrhea, sore throat, can be conjunctivitis, and after that maculopapular rash on the skin and complex spots on the mucous membrane of oral cavity. And symptoms, you can see this rash on the skin and inside of mouth. You can see in mucous membrane of cheeks, you can see these white spots. Measles, most serial complication, it's subacute sclerosing panencephalitis. This subacute sclerosing panencephalitis is a progressive neurological degeneration of the cerebral cortex, white matter and brain stem. It's nowadays detected that is one case in a million infections and involves a defective virus spreading through the brain by cell fusion and destroy cells. The result of this process involving these viruses is mental disorders, and after some period of time this process leads to coma and death in months or several years. For prevention this severe complication can be used attenuated viral vaccine. And on this slide you can see young patients with the severest complications, subacute sclerosing panencephalitis. So, one more time, prevention by alive and kill vaccines. It have to be used for avoiding complications because of infectional disease during the pregnancy. So young women have to be vaccinated. One more virus for today is respiratory syncytial virus, RS virus. The particle is slightly smaller than other paramyxoviruses, and RS virus does not hemagglutinate erythrocytes, so we can't use reaction of hemaadsorption, hemagglutination. This label paramyxovirus produces a characteristic syncytial effect, and the name of this virus exactly because of this property, biological properties, possibility to create fusion of cells in human cell culture, and this virus can cause serious bronchiolitis and pneumonia in infants. And on this slide you can see action of RS virus, exactly creation of this syncytium, abnormal big cells with numerous nucleus, and immunofluorescent test also show the same picture, but it's more specific type of investigation than usual microscopy. And you can see patients that can be infected by this virus. As a result, can be bronchiolitis, pneumonia, and quite severe process can lead to a rising of asthma. This complication. Transmission of this disease by coughing, sneezing, by droplets. Symptoms: runny nose, cough. As a result, can be bronchitis and pneumonia. Prevention. You can see a list of non-specific variant of prevention, but also can be used specific prevention. It's active immunization by inactivated vaccine, can be used subunit vaccine, and even passive immunization by immunoglobulin. And last piece of lecture for today is Coronaviridae family. You can see that genera in Coronaviridae family, it's coronavirus and torovirus. Torovirus associated with diarrhea, and today we are speaking only about genus Coronavirus. Genus Coronavirus has two serogroups of human coronaviruses, represented by strains 229E and OC43. Exactly with this group 2, exactly with this type OS43, connected this SARS virus that cause severe acute respiratory syndrome. Important properties of coronavirus. Virion, spherical, 120-160 nanometers in diameter, so it's quite big. Virus, helical nucleocapsid, single-stranded RNA, non-segmented and positive sense. Proteins, 2 glycoproteins and 1 phosphoprotein. Some viruses contain a third glycoprotein, hemagglutininylsterase protein, contain large, widely spaced club or petal-shaped spikes, and because of these spikes has this appearance named like coronavirus. Replication, cytoplasm, particles mature by budding into endoplasmatic reticulum and Golgi apparatus, and outstanding characteristic that cause colds and severe acute respiratory syndrome. Display high frequency of recombination and difficult to grow in cell culture. Pathogenesis of coronavirus infection in humans. Coronavirus infections in humans usually remain limited to the upper respiratory tract. In contrast, the outbreak of SARS was characterized by serious respiratory illness, including pneumonia and progressive respiratory failure. The SARS coronavirus caused severe respiratory disease. The incubation period averaged about 6 days. Early symptoms include fever, malaise, chills, headache, dizziness, cough, and sore throat, followed a few days later by shortness of breath. Many patients have abnormal chest radiographs, and some cases progress rapidly to acute respiratory distress, requiring ventilation support. Death from progressive respiratory failure occurs in almost 10% of cases, with the death rate highest among the elderly. Laboratory diagnosis, antigen and nucleic acid detection. Coronavirus antigens in cells in respiratory secretions may be detected using the ELISA test if a high-quality antiserum is available. SARS virus RNA was detectable in plasma by PCR, with viremia most readily detectable between days 4 and 8 of infection. Isolation and identification of coronaviruses in cell culture has been difficult. SARS virus was recommended from oropharyngeal specimen using Vero monkey kidney cells. And if we are speaking about immunity, as with other respiratory viruses, immunity develops but is not absolute. Resistance to reinfection may last several years, but reinfections with similar strains are common. Most patients with SARS developed an antibody response to viral antigens detectable by a fluorescent antibody test or ELISA. And it was important that the convalescent serum be collected more than 28 days after symptom onset.